This is a podcast from RNIB's Insight Radio.
Saturday, the 14th of November, is Diabetes Awareness Day. Lots of work going on into research of the condition and a lot of help and support out there as well from many avenues. Fight for Sight is a charity which is involved in fundraising. It then funds research into many different eye conditions, some rare, some very common, and diabetic retinopathy is just one of those. Dolores Conroy is with us from Fight for Sight. Dolores, diabetic retinopathy, what effects does it have on an individual and how prolific is it?
It's a common complication of diabetes, and it really causes damage to the retina at the back of the eye. The retina has the light-sensitive photoreceptor cells, and it damages those, so you can eventually end up with blindness. It's a progressive disease. We know in the UK there's about over 3 million people with diabetes, and each year about 4,200 people are at risk of diabetic retinopathy. The statistics show that there's about 1,280 new cases of blindness each year due to diabetic retinopathy. So this is, obviously quite a serious complication of diabetes. And not alone is diabetic retinopathy a complication of diabetes, you also have cataract and glaucoma. So cataracts and glaucoma are much more common in people who are diabetic.
Does diabetic retinopathy lead to complete blindness?
Yes, it's a progressive disease. In the early stages of the disease, you will not notice any difference in your sight. And this is why now we have an NHS screening program that anybody who's diabetic is screened for diabetic retinopathy. And this picks up the very early changes in the retina, and then they can monitor the disease. And if necessary, these patients who have sort of more severe disease can be treated, and we do have quite good treatments, mainly based on drugs that block the protein that makes new blood vessels. The problem with the late stage, the sight-threatening stage of diabetic retinopathy is you get new blood vessel growth in the eye, and these new blood vessels are very fragile, and they break and they scar and they leak their fluid. And we need to stop this new blood vessel growth. So there are drugs that effectively work. Obviously, they cost a lot of money. In the earlier stages of the disease, we can with laser treatment, we can block the growth of some of these new blood vessels and stop them leaking their fluid. So we do have effective treatments, but it is costly, and it is a burden on the NHS and a burden on the patient. And obviously, we are funding a very large program of research at Fight for Sight. Currently, we have a program worth over 1.2 million, and we're looking at various aspects of the disease. We're trying to understand a little bit more about the mechanism of disease, what happens in the very early stages. There's a lot of evidence pointing to inflammation being a causal factor. We're looking at developing, obviously, new therapies, be it a drug therapy. We've got some exciting programs on stem cells, looking at the regenerative potential of vascular stem cells to actually repair the damage that the high blood glucose does to these blood vessels. In addition, we're interested in, obviously, early detection of disease. As we know, if we can detect diabetic retinopathy early, we can prevent sight loss.
Fundraising is a vital part of what Fight for Sight does. It helps fund all this research, and they're always looking for new ways of fundraising, new partnerships. One organisation is called Polyphotonics, which has an interest in diabetic retinopathy as well. Richard Kirk is their chief executive. Richard, tell us a little bit about the company.
I think that principle was slightly different to other medical companies in so much as we came to our knowledge of this through physics and chemistry. We're a company of physicists and chemists and mathematicians. So we're a geeky science company, material scientists, and we work with photons. And through our explorations of, the effect of a photon on the body, something called biophotonics, we had an insight into the way that the eye responds to photonics that was slightly different to the usual. And that insight led us to believe that the way the eye responds at night to photons when it dark adapts had a slightly different effect than was previously understood. And so for the last 5 years, we've been on a research path. We've been developed very novel, interesting, new treatments for diabetic retinopathy.
Now, you are going to be helping Fight for Sight, and it's all to do with a mask which you produce.
That's right. Fight for Sight, they'd speak for themselves. Very, very large, well-established and very well-known charity that funds research. So we've been aware of Fight for Sight for many years. And in turn, Polyphotonics has had a lot of government grant research funding, mainly from the NHS, actually, as we progressed and developed. And our device now, it's a medical device, the treatment is actually a mask. As that's come through to market, we thought that a link in with Fight for Sight, and in essence, putting something back. I think that's the way we view it. We've had a lot of government support to get Polyphotonics to where it is. And now, in turn, we'd like to participate in future research. So we thought, this link with Fight for Sight was the perfect way to do that.
Tell us about the mask and how it works.
So the mask itself is quite similar to the kind of thing you would wear on an aeroplane. It's a sleeping mask. So you wear it at night while you're asleep, and it emits a very precise wave of light that doesn't inhibit sleep. And we do that because obviously everybody's aware of your rods and cones. And not everybody's aware that when you actually go to sleep at night, your rod response doesn't stop, and it continues to demand more and more oxygen. And I think the unusual thing about the eye is it's actually the most oxygen-demanding organ in the body. So when you do go to sleep and you dark adapt, this hypoxic state develops because your rod is demanding more oxygen. You get the hypoxic state, and then the body responds by producing a protein which stimulates neovascular growth. So you get this new vessel growth at the back of the eye and the macula, which is perfectly normal. But if you're aged or if you have diabetes, then that new vessel growth is compromised, and it starts to break down and leak, and that can lead to little aneurysms and bleeds, or eventually cysts, which form on the fovea around the cone, so you can lose your central vision. And that's the basic principle with retinopathy and maculopathy. So we worked out that if we could put a very precise dosage of light into the eye that only the rod will respond to, and that's the clever bit, the cone actually doesn't see the light wave that we're putting in the eye, so it doesn't inhibit sleep. But we break that cycle of hypoxia. So you don't get upregulation of the VEGF, which stimulates neovascular growth, and you don't get the hypoxic state. So we've almost taken it right back to the origin, and we're breaking this vicious cycle of hypoxia, neovascular growth, and damage. So it's very, very simple, remarkably simple, but it's actually taken about 6 years and many millions of pounds worth of funding to get us there.
And all through the use of light. Richard, if anyone would like to find out more about the company, about the mask itself, how would they get in touch with you?
They can go onto our website, which is polyphotonics.com or noctura.com, which is the name of the mask. And there's a helpline number as well, which is 01740 669 143. And there you will be put through to one of our advisors who, will talk you through the mask and also understand the condition. I think one of the clever things about the mask is that it's intelligent, and it's actually packed with electronics. And so what the mask is doing is measuring dosage throughout the night and understanding the amount of light that's put into the eye. And then at quarterly intervals, so every 3 or 4 months, the mask needs replenishing, it needs changing. But at that time, we can look at the eye again and understand the progress of the disease and understand the efficacy of the mask. Basically, is the mask working? So that's a very useful tool for the physician.
Amazing piece of technology. Dolores, exciting news to be partnered up for Fight for Sight.
Yes, we're very excited with our collaboration with Polyphotonics, and we're delighted that they have chosen us as their charity partner. Obviously, it's an ideal partnership because we're both united in our aim of developing new treatments for eye disease, and we're very excited about the Noctura approach, and I think it's a really exciting future for treatments of diabetic retinopathy. Just finally, Dolores, if people would like to learn more about Fight for Sight and its work, the fundraising, how can they get in touch? You can look on our website at fightforsight.org.uk, or you can call us on 0207 264 3900. Dolores Conroy and Richard Kirk, thanks to both of you for speaking with us on Insight Radio. Thank you.
Thank you very much.
Thanks for listening to this podcast from RNIB's Insight Radio. For more podcasts, check out insightradio.co.uk.